Number 42. A 56-year-old man undergoes a left upper lobectomy. An epidural catheter is inserted for post-operative pain relief. 90 minutes after the first dose of epidural morphine, the patient complains of itching. His respiratory rate drops to 9 breaths per minute and he becomes increasingly somnolent. Blood gas measurement reveals the following: pH 7.24, carbon dioxide 58, oxygen 100 and bicarb 28. Which of the following is the most appropriate initial therapy for this patient? Number A, naloxone administration. Number B, diphenhydramine Benadryl administration. C, flumazenil administration. D, glycopyrrolate administration. And E, endotracheal intubation. So the answer is A, naloxone administration. 43. A 71-year-old man returns from the operating room OR after undergoing a triple coronary bypass. His initial cardiac index is 2.8. Heart rate is then noted to be 55. BP is 110/80. PCWP is 15 and his cardiac index has dropped to 1.6. He has a normal left ventricle. An increase in which of the following will increase his cardiac output? A, peripheral vascular resistance. B, central venous pressure. C, heart rate. D, blood viscosity. And E, inspired oxygen concentration. So the answer is C, heart rate. 44. A 73-year-old woman with a long history of heavy smoking undergoes femoral artery popliteal artery bypass for rest pain in her left leg. Because of serious underlying respiratory insufficiency, she continues to require ventilatory support for 4 days after her operation. As soon as her endotracheal tube is removed, she begins complaining of vague upper abdominal pain. She has daily fever spikes of 39, 102.2 degree Fahrenheit and a white blood cell count of 18,000. An upper abdominal ultrasonogram reveals a dilated gallbladder with pericholecystic fluid, but no stones are seen. Which of the following is the best next step in her treatment? A, administration of broad-spectrum antibiotics. B, laparoscopic cholecystectomy. C, percutaneous drainage of the gallbladder. D, endoscopic retrograde cholangiopancreatography. And E, no additional therapy. So the answer is C, percutaneous drainage of the gallbladder. 45. A 32-year-old man undergoes a distal pancreatectomy, splenectomy and partial colectomy for a gunshot wound to the left upper quadrant of the abdomen. 1 week later, he develops a shaking chill in conjunction with a temperature spike of 39.4. His blood pressure is 70/40, pulse is 140 and respiratory rate is 45. He is transferred to the ICU where he is intubated and a Swan-Ganz catheter is placed. Which of the following is consistent with the expected initial Swan-Ganz catheter readings? A, decreased cardiac output. B, decreased peripheral vascular resistance. C, increased pulmonary artery pressure. D, increased pulmonary capillary wedge pressure. Or E, increased central venous pressure. The answer is B, decreased peripheral vascular resistance. 46. A 43-year-old trauma patient develops acute respiratory distress syndrome ARDS. After the positive end expiratory pressure is increased, the patient's oxygenation improves. What is the mechanism by which this occurs? A, decreasing dead space ventilation. B, decreasing the minute ventilation requirement. C, increasing tidal volume. D, increasing functional residual capacity. And E, redistribution of lung water from the interstitial to the alveolar space. The answer is D, increasing functional residual capacity. Number 47. A 27-year-old man was assaulted and stabbed on the left side of the chest between the areola and the sternum. He is hemodynamically unstable with jugular venous distension, distant heart sounds and hypotension. Which of the following findings would be consistent with the diagnosis of hemodynamically significant cardiac tamponade? A, more than a 10 mm mercury decrease in systolic blood pressure and expiration. B, decreased CVP. C, equalization of pressures across the 4 chambers on Swan-Ganz monitoring. D, increased respiratory variation of the IVC. And E, overfilling of the right atrium. So the answer is C, equalization of pressures across the 4 chambers on Swan-Ganz monitoring.